Good afternoon. My name is Hepzibah Gekombe. I have two patient scenarios, and these scenarios are geared towards crisis management in a PMHNP class. Now, the first case is a 45-year-old male who has been married for 15 years with two children. He has history of major depressive disorder and pornography addiction, which has been dealt with through therapy. This addiction has caused some trouble in the marriage, but for the past 5 years, things have been going really well in the marriage, and the patient denied looking at porn. The major depressive disorder started in early 20s and have been well managed with citalopram 20 milligram daily. So he comes in today visibly upset. He reports his wife has been cheating on him for 2 years, and he found out when he came home from work to find his wife and kids gone. A note that detailed her infidelity, and she took the children to live with the man she had been cheating with. Divorce proceedings are in effect. He states, his own words, "I had no idea. I know I had my own problems, but 2 years? I feel so stupid. I don't know why I bothered improving myself. I don't know how I can even go on. My work made me take some time off, but I have continued to call in. I am at risk of losing my job, but I just can't bring myself to go. The kids are my world, and I haven't even talked to them for a month. Now, I question him about suicidal or homicidal ideation, and he replies that he has been suicidal since she left and has been drinking at least 6 packs of alcohol a night. He has had plans to shoot himself. When asked what is keeping him from acting on the plan, he said, "My kids. But I'm losing hope I'll ever see or talk to them again. Now, what are my next steps?" So we're talking about crisis management here. So the next step, and my answers are based on several references, and one of them is American Psychiatric Association, where it talks about practice guidelines for the patients with suicidal behaviors. And another article talks about reducing suicide, a national imperative. Another one is suicide risk management, assessment and management in adults. Okay, back to the case. What are my next steps in this case? So this 45-year-old man is going through a tough time, coming to the clinic, reporting about suicidal ideation. He sounds like he wants to shoot himself. So he has an active plan. My immediate steps are as follows. Number one, I'm going to ensure safety of this 45-year-old man. The patient should not be allowed to leave the clinic at this time. We have to maintain a calm, supportive environment and ensure he remains under supervision while further steps are taken. First, we ensure he's not leaving the clinic. Number two, we are going to initiate emergency psychiatric evaluation. So that means we are going to transfer this patient. He needs urgent psychiatric evaluation at the hospital. So we are going to arrange for transportation. We can call EMS to take this patient for same-day evaluation. He's obviously going to be inpatient psychiatric admission. We are not going to let him go home. And then address or assess the lethal means of him planning to shoot himself. So what we can do is make sure we remove all the firearms from the house. That way we can initiate or work with the patient and family, if anybody is available. Obviously, his immediate family, the wife and the children, are not there. So we are going to find out if he has another close relative or a very close friend who can ensure that the firearms are removed from the house, and then they are kept in a secure place. And then considering involuntary hospitalization at this time is necessary. So if the patient refuses voluntary hospitalization, we are going to ensure or initiate procedures for an involuntary psychiatric hold, because he's a danger to himself. He has a plan, and also the plan is to shoot himself. Okay. Another thing is evaluate substance use, which is alcohol. He's drinking 6 packs per night. Research shows that alcohol use increases the risk of suicide, and therefore he needs further evaluation and management during hospitalization or at the hospital. And then we are going to ensure, or while in the hospital, we are going to ensure that he gets support. So we are going to employ or use empathy, non-judgmental language. We are going to validate his distress. He's in a lot of distress. He has lost his family. We are going to empathize with him as well, and help with the treatment that will be available for him at this point. We are going to minimize his feelings while reinforcing the importance of immediate care at this time. So after the hospitalization, this is our client. Of course, he will be discharged when he's stable. So our job is to ensure that we have ongoing follow-ups where we can adjust his medications. Right now, he has been taking citalopram. Obviously, his depression it's really high, so he has progressed in his depression, major depressive disorder. So he's going to need some adjustments on the therapy that he's taking. Also, he's going to need cognitive behavior, some type of behavioral therapy, which will be cognitive behavioral therapy in this case as a form of psychotherapy in conjunction with the medication. And then we're going to ensure that he's going through substance use treatment as well to help him reduce the alcohol intake, and as well as reach to the abstinence level, because it's going to increase his suicidal risk even after discharge if he continues to drink. We are going to ensure he gets social support or legal family counseling. He's going to need a lot of support so that he does not regress after discharge. So in summary, this patient has active suicidal ideation. We're going to make plans for psychiatric emergency transfer so he can get evaluated because of safety concerns. And obviously he will need inpatient psychiatric admission. And that's the end of my first case. Next case is a 19-year-old married female with a 2-month-old baby. She's here for the 4th visit. Her husband is present today during the visit. She presents dressed more provocatively than she has been before. Her makeup is heavier than usual. The baby is in a carrier and is sleeping. She immediately starts the conversation about a video series on aliens she has been watching. Her speech is rapid, loud, and tangential. She makes several loosenesses of association between the video series and her baby. From the rumbling, it sounds as if she believes the baby is an alien and she needs to take it to the desert and leave it to the mountain for the aliens to come and retrieve. She reports making plans to go camping with the baby and her husband this weekend. And then I question her about suicidal and homicidal association, and she denies both. The husband, however, states she's been acting different for a couple of weeks, has never behaved like this before, and he is scared to leave her alone with the baby. She interjects immediately, and she knows that the secret to world peace and giving their baby back to the aliens will accomplish. So what is my next step in this case? Okay, and this case, I looked up several articles, and one of them is OBGY, screening and diagnostic mental health conditions during pregnancy as well as postpartum. And then there's an article that talks about postpartum psychosis, a proposed treatment algorithm, and also postpartum psychosis, a preventable psychiatric emergency. Okay, so this 19-year-old, the baby is 2 months. This is a psychiatric emergency situation. It's most concerning of postpartum psychosis. This occurs weeks to months, like the weeks of the month after the baby has been born, and this is where high risk of postpartum depression or psychosis occurs, and this carries a risk of harm to the baby if the patient, even if the patient denies suicide or homicide intent. So in this case, for the 19-year-old, there are key findings that are very concerning that needs emergency psychiatric evaluation and treatment. Number one, the baby is 2 months old. It's a recent childbirth, and then there's a delusional beliefs. She believes the baby is an alien. She has disorganized thinking where her speech is rapid, loud, tangential, and then she has loose associations as well. She has grandiose ideas. She says she knows the secret to the world peace, which she further states that she needs to give the baby back to the aliens. And then her behavior has changed. That's reported by the spouse that she has been behaving strange lately or in the few weeks. And then she has plans, of course, of taking the baby to the desert. So the husband himself is afraid to leave her alone with the baby. So this patient has some dissolutions that is involving the baby, especially this is very dangerous, and this is concerning for postpartum psychosis. So my next steps on this case is to ensure safety of the baby. I'm concerned about the baby. The husband is concerned about the baby. So we are not going to allow this patient with the baby, even in the room. And we're not having this patient to leave today the clinic with the baby. So we'll ask the patient to remain with the patient and with the baby, make sure the baby is under supervision. And if we need, we can have an additional staff to come in the room and stay with them. And then we have to separate the patient from the baby while maintaining a calm, non-provocative environment. Then the next step is to initiate emergency evaluation. And how do we do that? We are going to plan for immediate psychiatric evaluation. We are activating the EMS to transfer this patient for inpatient hospitalization. And then the reason why we consider hospitalization, she has active psychosis going on. She has delusions about the infant, and she has demonstrated impaired judgment and reality testing. So she meets the criteria for involuntary psychiatric hold, and she's danger to the baby at this according to the scenario. So we'll keep her in the clinic while we observe. We do observation until EMS arrives and make sure she stays calm, and make sure we are calm as well, and use a non-confrontational approach during this time. And then once the emergency transfer arrives, she's going to be transported to the hospital for further evaluation and stabilization of the psychosis symptoms. Once the transfer The patient should receive at the hospital, of course, a full psychiatric evaluation, screening for any medical causes that might cause psychosis for this young lady, and possibly she will be receiving antipsychotics and mood stabilizers. So my rationale to my steps is because of the delusions involving the baby, thinking the baby is an alien, disorganized thinking, rapid mood change. She also has poor insight that was noted in her speech. So there's a significant risk of harm to the baby, and this needs immediate intervention and hospitalization to receive care. And these were a really good case, and that's the end of my presentation. Thank you.